University. He graduated with his BSN degree from Baikal University, College of Nursing in Liksabi City in Philippines in 1996. Then, in 2001, he got his master's degree in science education, which was issued from the same university in the Philippines. He is a licensed nurse in the Philippines and multi-state registered nurse holding in the US. A few years later, he achieved the Master of the Science in Nursing Administration from Xavier University, College of Nursing in Cincinnati, Ohio in the USA. Later, in 2015, he succeeded to obtain the Doctor of Nursing Practice in Healthcare Leadership System and Policy from Yale University, which is located in the New Haven in Connecticut, USA. At the present, he is toward the attending of the Doctor of Education in Nursing Education from Teachers College in Columbia University in New York. As a seasoned executive, he held various key positions in 2015 and to 2016. He took a position of a clinical nursing director from Tufts Medical Center in Boston. Then, in 2016 to 2021, he became a director of a global standards and qualification from CGFNS International, New York in USA. And at the present, Chief Executive Officer from Apex Global Partners in Washington, Director of Columbia. In 2015 to 2016, he held adjunct clinical instructor from Simmons University, MSN program in Boston. Then he became an adjunct nursing professor in 2017 to 2018 in Wilmington University in Wilmington. He received many awards, such as Excellence in Leadership and Management from Philippine Nurses Association in the America, New England in 2018. And in 2019, LinkedIn 15 Future Leaders of Nursing in New York. And lastly, in 2020, he got a fellow, the Fulbright Commission in US Jordan by National Fulbright Commission in Jordan. Since 2020, he served as a co-chair of the National Ethical Committee in the Philippine Nurses Association of America. And in 2021, he got up to date. He appointed as a member of board director in Global Defeat Adult Rheumatism Everywhere. He has published a number of scientific papers and has worked in the capacity of counsel from major nursing and health-related institutes. My dear co-students and respected faculty members, let us all welcome our guest speaker, Dr. Jasper Toralpa.
Hello, everyone. Can you hear? Hey, Doc Glenn, can you hear my audio?
Yes.
Okay, let me just try to see if I can share my video as well. Can you see my video?
Yes, doctor, yes.
All right, perfect. Well, good afternoon. Good morning there in Oman. I'm actually behind with time. It's 12 midnight here in the East Coast in New Jersey, where I am right now. So thank you for inviting me over, and I'm hoping that I'll be able to share with you some of my knowledge on the topic at hand. But just a brief overview, I'd like to thank Dr. Glenn Valdez for inviting me, as I've mentioned, and him and I worked with several projects in the past. I think, Dr. Glenn, correct me if I'm wrong, in 2013, I also gave a webinar with your colleagues there in Oman I think 2013. So we go way back, right?
Yes, doctor.
And yeah, so I think him and I have several projects together. So I'm really delighted that today I'll be able to again collaborate with Dr. Valdez for this webinar. Quite honestly, he actually just called me on my phone because I thought the seminar would be tomorrow, April 10th, because it's still April 9th here in the East Coast. And now my phone was ringing, and it was actually Doc Glenn telling me that it actually was today. So thank you, Doc Glenn, for for basically
No worries.
waking me up. So that was a confusion on my time with the time differences. Thank you also for the generous introduction. And what time do I have? Is it an hour, Dr. Glenn? I'll try to
Yes,
make it
doctor.
shorter.
Yes, one
All right, I'll try.
hour.
Okay, perfect. I'll try to make it quick and straight to the point because I know that we are starting. I'm starting late, also. So for the respective time for everyone, I'd make it short and direct to the point so that we could cover the content as much as we could. Thank you for the generous introduction. I forgot who gave the introduction, but appreciate you giving some of my background. I would try to share my screen, Doc Glenn. Is that okay?
Yes.
Okay.
Manny, can you exit the slide, please?
Yeah, I think that would be
Okay.
okay. And then what I'm gonna do is I know where to share my screen here now. Oh, here it is.
Cheers.
All right. Can you see my screen?
Yes, doctor.
All right, perfect. All right. Are you able to see my screen, Doctor? I'm sorry, I'm having
Yes,
trouble.
doctor, but it is in the presenter's view. Can you
Is it okay?
just click on the three buttons on the lower part of the slide, the big slide. Okay, buttons, dot, dot. The other one, the dot, three dots or four dots, I think.
This right here?
The other one, yes, at the other end, doctor.
This one right here? Oh, this one right here.
And,
Hide presenter view.
yes, hide percentage. Then slides,
From
slideshow.
beginning, right?
Yes. You can click slideshow, doctor, on the lower part.
I think I'm sharing because I have 3 screens. That's why it's making it more
Just select the
confusing.
big one. Yeah, this one.
All right, perfect. There you go.
It's not yet there.
I'm sharing the wrong screen. Let me share again.
Okay, that looks good.
Is that better?
Yes. Yes.
Am I not on the presenter view?
Yes, doctor. Yes.
All right, perfect. Okay, thank you. So today we're going to talk about our organizational culture, change, and innovation. And I'm hoping that that today we'll be able to discuss some ways to manage cultural diversity. It's not changing on my end here.
Maybe you have to click on the active slide, Doctor, or close some of the slides. Happens sometimes. Okay, no, it's
All
working.
right, perfect. Do you know what's going on? I have 3 screens in my computer. So I don't know which of the computer screens is presenting. So anyways, I think this is it. So anyways, today's objectives would be to discuss the ways to manage cultural diversity. We'll try to also compare creativity and innovation. And hopefully we'll be able to discuss the change strategies, types, and leadership and management role and resistance to change. But before that, I'd like to give a little bit background of my professional work in terms of the clinical setting. So I worked for about 6 years at Yale New Haven Hospital, which is located in New Haven, Connecticut. And it's one of the largest health system or organization in the United States. We have about 1,541 bed hospital. It's a level 1 trauma center for both the adult population and the pediatric population. We had a total of about 1,300 employees, both clinical and non-clinical, and about 4,136 medical staff. That means the doctors and other providers. We were also, we are still an ANCC magnet recognized for the quality and credential accreditation. In that service, I was able to manage, and I was the manager for the psychological medicine service. So as you can see, I'm on the second to the left side, the bottom there. And these are the team of clinicians and non-clinicians as well, because in my team, I had social workers, I have clinical nurse specialists, nurse practitioners, and some of the medical staff, which actually do not report to me, but they work alongside our non-medical clinicians. So that's my staff or my background. So basically, the service provides psychological medicine or psychiatric consultation for all the medical patients in the hospital, providing psychiatric consultation and psychiatric intervention. So as I've mentioned earlier, we have myself as the patient service manager. We have 4 advanced practice nurses. We had 2 clinical nurse specialists and social workers, and then 2 psychiatrists. So basically, we work alongside the nurses on the floors who are working. And if there were patients who needed psychiatric consultation or assessment and evaluation, as well as intervention, we work alongside the primary team. That means the surgeons or the medical physician that are the primary provider of the patient, and provide them with recommendation and consultation and assessment for the of their patients. So that's what we call the multidisciplinary patient centered model of care. So the patient is always at the core of all the interventions and activities while in the hospital, but we all provide that care and actions for the patient. Now, why am I discussing this program, the BIT program? I think this is a good segue to understanding our topic for today, which is organizational culture, change, and innovation. Because before I joined the organization in 2010, there was no BIT model of care at the hospital. And so when I actually joined the organization at Yale New Haven Hospital, they told me that I will be launching a new program at the hospital. And so the mere fact that there will be a new program for the whole hospital, right? It's difficult for, it's a different process and different steps in order to implement a new program. You have different stakeholders that you will have to convince, right? So that they will be able to adapt to the new program and believe in the program and implement the program. So I think that that's a good a segue into our topic for today on how to actually create and impact organizational culture, change, and innovation. Any questions so far? Dr. Glenn, can you monitor the chat room in case there are questions? And please don't hesitate to interrupt me while I'm discussing, because I prefer to actually just address questions along, along the way while we're talking, so that I'll be able to address it while we are on the topic. So Dr. Glenn, if you have chat room, can you just, just monitor it, and please don't hesitate to interrupt. All right.
Sorry, Dr.
All right, perfect. So first of all, let's talk about culture of individuals, because when you are trying to, I think, implement change and understand organizational culture, you first have to understand the culture of the individuals that are involved, right? So when you discuss about culture of individuals, we are considering and talking about the values, the attitudes, the perception, and the roles and cognitive styles of all the individuals that you are dealing with. And as managers, and I assume, Dr. Glenn, most of your students here are, are students who are also going to be managers later on in their career, or if not, they're already managers. It's important for them to understand these concepts, because as nurse leaders or future nurse leaders should be able to understand the individuals that you are dealing with, not just your subordinates, but also your peers and colleagues. So still on values, you have to understand that values are basic convictions of individuals of what is right and or desirable. And as a result, they help individuals to decide which mode of conduct is preferable to others. It's also a value systems that express an individual to, or express individual values to in order of their relative importance, to provide a foundation of attitudes, perceptions, and personality roles. So basically what it says is that when you talk about values of people, you are actually talking about an understanding about what each person's belief system and what do they prefer and what do they do in certain situations. And those actions are actually grounded upon the value systems that they have developed throughout the years. So when individuals make actions or decisions, it's rooted upon what they have already developed as a value system. How did their parents, instilled in them the decisions that they will make in life. So if they were grown up as conservative individuals or are liberal individuals, or growing up in a certain religious belief system, those are factors that influence their value systems and belief systems that in turn allow them to make decisions and act on things depending upon those value systems that they have developed throughout their life. And as such, because they have already grown those values from, from a very young age and throughout their life, those belief systems and those values that they hold on to may actually cloud their objectivity and their rationality, right? So when you deal with individuals, so for example, you are a nurse manager, and all of a sudden you have individuals, or you have a nurse, for example, that would not do what you instruct them to do, or that you expect them to do something, but they did not. You have to understand that, or you have to make a way to understand their values and belief system. I have been in situations where I have nurses or a doctor complaining to me that one of my nurses did not want to give a blood transfusion to a patient. And, as a nurse, that's one of our responsibility to do those nursing action, to give blood transfusion, right? And then so I talked to the nurse and said, hey, you have an order for a blood transfusion. And, I thought the nurse was just being insubordinate. She just, does not want to do the work. But then upon discussing it with the nurse, I learned that her religious belief prohibits, her from doing that particular action, because in her religion, they do not allow, and they believe that providing blood transfusion is actually part of their belief system in their religion. Their religious belief prohibits them from doing such a thing. So for us who believes in blood transfusion, it appears to us that it is the rational thing to do, because our patient is on the verge of dying. But because for us it might appear that it's the rational thing to do, those people who have a different belief system and value system, we think that it's irrational, right? But then again, we have to understand as nurse leaders that certain value system may actually cloud objectivity and rationality, but it doesn't necessarily mean that it is on the wrong. We just have to acknowledge that not everyone have the same value system and has the same belief system, right? So basically, values are then relatively stable and enduring, and generally influence decisions and behaviors. So for other people, that is already their set of behaviors that they believe. So then that becomes the norm, and that becomes this, their rational thing to do, right? But in other people, they might consider it as an irrational or perhaps a wrong thing to do. So there's a lot of variability depending on where you are standing in that spectrum. So our values actually must dictate, no matter what our value system in the hospital. And I'd like to point that out before I'll go over the different sections here. When you join an organization, and I learned this when I went through my management courses um, in the hospital, because as new managers way back, long ago, all the managers we have in the hospital, have to go through management training. And in this slide, what I still remember when they talked about this slide is that it is important as new nurse managers and leaders that they would be able to know your own value system, right? And when you join organizations and institutions, you have to make sure that your values align with the values of the organization that you are joining, right? So that is why it's important that before you apply to hospitals or academic centers or academic institutions, you have to investigate their um, mission, their vision, and their values, because not all institutions have the same values, right? Um, to give you an example, uh, we have institutions here. I'm not sure there it's the same here there in the Middle East, but in the United States, we have clinics and health systems called Planned Parenthood. It's where they believe that abortion and termination of of pregnancy is normal, right? Because for several reasons. It could be that the mother, was subjected to a rape, or perhaps a pregnancy is not normal. The baby had some, disabilities while in the womb, genetic um, anomalies and all that. So therefore, the organization or the clinic actually supports abortion for those reasons that I have mentioned. Um, and people believe their values believe that that's normal to have an abortion, because nobody wants to have a baby that has trisomy 21, for example. But if that's the belief system and that's the service of the organization, and here you are coming in from a different religious and personal belief system, joining that particular organization does not make any sense, right? Because sooner than later, you will say, why am I doing this procedure? It does not jive and it does not align with your own personal belief system. So it goes back to what I was saying earlier, that when you join organization, your values must align to the values and the mission and the vision of the organization. Otherwise, it will be a failure. Not your personal failure, but a failure in the relationship and to your service and your performance that you're trying to provide to the organization. But then your values, if you join an organization that aligns with your own personal values, it has to actually, the outcome should actually have these different aspects. So you're able to collaborate with your peers and your colleagues. You should be able to provide a customer focused service. Take the patient and the family as your focus um, of service. You should develop excellence in your work. You have respect with everyone. You have integrity, and because of all those, you provide safety. So those are not individualized characteristics and values, but those are interrelated. So that means that if you collaborate with your peers and other clinicians, you provide safety. When you have customer focused service, you develop integrity. When you have excellence, then again, you have respect and safety of your practice. So those are interconnected, intertwined, but those are all grounded upon your values and the values of the organization that you serve. So that's why it's called our values, not just your values, but the values of all stakeholders in that particular setting. So attitude, I think, are quite self-explanatory. Those are, the mental state of readiness of individuals as a result of the experiences, and therefore it exerts influence on a person's response to people, objects, and situations, right? Attitudes are like values are learned from parents, teachers, and peers, but attitudes are less stable than values. And still, they also influence behavior and actions of individuals. So just like, values, attitudes are still, belief system, but not as ingrained and stable as that of a value system. Sometimes attitudes can be short-lived as well, and and can easily be changed or swayed, as opposed to value system where it's been ingrained from the individual experience. The tolerance of ambiguity refers to the degree in which a person is threatened by the unpredictability or has difficulty dealing with complex situations. And people with tolerance for ambiguity and complexity are more adaptive. So again, later on, we'll talk about people who are easily adaptable to change, but tolerance of ambiguity pretty much refers to individuals who are open-minded, open to change, has the ability to be resilient to the change, understanding that life is not predictable, and so does everything else in the workplace. Perception is the psychological process that makes sense out of what the individual sees, hears, smells, or tastes, and their personal experiences and value system is affected or affects the perception of the individual. So therefore, your perception might be different from my perception, depending on our experiences and prior belief system or established belief system. So with that said, we have selective perception. That means that, we perceive situations different depending on our own experiences and our belief system. We tend to stereotype people. We say, oh, you're from this side of town and I'm from this side of town, or you're a male, or and you're a female, so therefore so and so, right? We tend to people always tend to have some stereotype perception or a self-fulfilling prophecy, and we'll say, that's just what it is. There's nothing that we can do to change things, right? So it's almost like a self-fulfilling prophecy of things cannot be impacted or changed just because it's already set to happen. Personality, again, I don't probably have to explain this with you. It's very self-explanatory. It's a set of characteristics that individuals have as influenced by inheritance, by social situations or upbringing, their culture, and environmental factors. So these different factors are the ones that create our personality. We all have different personality, even twin siblings, they came from from the same parent, has the same genetic makeup, but even the identical twins have different personality because obviously they have different social experiences. There's some different environmental factors that affect those individuals, and so that's every one of us. We have different personalities because we come from different experiences within our daily lives. When I see this slide, I always think about stereotypes, right? So we will always tag people like, hey, you're quiet, so you're introvert. Oh, somebody is always talking, they are, people person, so therefore they're extrovert. But I think it's useful to just know what introvert and extrovert means. That mean introvert means that they tend to be um more, how do you call that, they have more self, a realization. They take time to process their thinking. Extrovert are those people who tend to just blurt out what they have in mind without filters or without further thinking. So those are just some of the typical characteristics of what introvert and extrovert means. One of the types of tests that psychologists or psychiatrists would like to give is what we call the Myers-Briggs type indicator. And these are a set of questions, random questions. It's a, I shouldn't say random, but these are a set of questions that are purposely designed to determine your personality. Okay, so I have taken this instrument or personality examination or test. They typically give this to employees joining the organization, especially for new nurse managers, so that they'd be able to know themselves first and foremost. And this allow them to also adjust and be cognizant about not just their own personality, but the personality of others. So the outcome of this test determines if individuals have these different personalities. So as you can see, what we talked about earlier in this slide, we have persons who are extroverted. That means they are energized by people. They enjoy a variety of tasks. They have a quick pace and very good at multitasking. So those are very outgoing people. Then you have those introvert people. They often like working alone in small groups. They really, they're more elaborate in their pace and like to focus on one task at a time. And there are also those people who are thinkers. They tend to make decisions using logical analysis, objectives. They try to want to, the way in the pros and cons before they make decisions. Then there's the fillers. That means they want to, be sensitive first, and they want, cooperation. They decide based on their own personal values and feelings and those kind of things. Then we have the sensors. They are realistic people who like to focus on the facts and details and apply to common sense. And those people who are intuitives prefers to focus on the possibilities and the bigger picture. See the patterns and see the value in innovation and seek creative solutions to problems. Then you have the judgers. They tend to be organized and prepared. They like to make, or stick to plans and are comfortable following a set rule of values. And finally, you have the perceivers. They prefer to keep their options open, like to, be able to act spontaneously depending on situation. So they want to be flexible, basically. So these are the different types of personalities that as nurse managers, you should be able to know your different employees, where they are in the spectrum because depending on what type of personality they have and individuals they have in terms of their belief system and their values, you should be able to adjust your treatment and your actions of and basically on how you deal with your employees. There's no such thing as, you know, a um one pill one pill, you know, solves everything type of situation in nursing management. You always have to adjust to different personality of your employees. Let's briefly talk about the roles of individuals in the organization. It's the collection of the concepts, definition, and hypotheses that predict how actors will perform in certain roles, under what circumstances given behaviors can be expected. And roles are acts or behavior expected of a person who occupies a given social position. So if you are the nurse manager in the organization, oftentimes your you know, your belief and your personality had to be overtaken and be adjusted to the roles that you have in the organization. So if your organization is adopting um, a certain action, so for example, they're getting a new, you know, EMR system, your role as a nurse manager is to implement that particular system in your own unit or your own department, irrelevant if you believe in that particular product or not, right? Because your organization, for example, has decided to go, you know, decided to say, for example, wanted to adopt a certain product of IV lines, right? So it doesn't matter if you believe in that particular product, but as the nurse manager of the organization, your role is to pretty much implement that particular product line so that it can be used by your nurses. So your role in as a nurse manager dictates the actions that you have to make. So therefore, you have to understand the role that you are in so that you'll be able to make things happen. Because if you do not know your role in the organization, it might have a difficulty on implementing and then, you know, guiding your staff on what to do for your staff in the organization. Similarly, your position also, as I mentioned earlier, just like your role, your position also dictates what your actions gonna be. So position sometimes can be as you know, ascribed or achieved. So it can be something that you are designated upon, or you basically achieved it by informal. So you are being seen by your peers as a leader, even though you do not have the particular designation of being a leader, right? You're not the nurse manager, but people actually see you as a leader because you have the tendency to lead others. A person has little or no control over ascribed positions as age, gender, or birth order in the family, while there are some degree of control if your position is achieved, such as marital status, occupation, and social status. So this is similar to, you know, a nurse leader. Everyone can be a nurse leader. It doesn't have to be an achieved, you know, role or position. You can influence your peers even though nobody gave you that designation as a nurse leader. But if you are able to influence and you gain the respect of your peers and they follow what you say, then therefore you are a nurse leader. That is something that you have, you know, basically informally acquired not designated by others or by the organization. Now, diversity is a state of being different and having variety. There's strength in diversity, right? So there are some internal factors, external factors, and some organizational factors on diversity. So I won't read this to you. So internal factors are here, as you can see. You have the age, gender. External factors are categorized on the middle part here. And then the organizational factors for diversity are on the far right of the slide. Culture, I think we haven't touched base on the culture yet. So basically the culture is the accumulation of attitudes, the beliefs, concepts of the universe, experiences, hierarchies, meanings, notions of time, religion, and all those different factors all intertwined and amalgamated together create a culture, a certain culture. So that means that the culture of the organization are all these different factors blending in together. As nurse leaders, we're expected to manage cultural diversity of our employees. So therefore, we are expected to be knowledgeable about the beliefs of different culture. So that means as nurse leaders, you should know what are the different cultures of your employees, because as we have discussed earlier, the culture and the values of your employees will determine how you deal with your employees. You should also know, as nurse leader, to know the importance of cultural diversity. You should develop orientation programs, seminars, role playing, skill building, and workshop amongst your employees if you are the nurse manager, because that allows people to actually know others' value system and culture, so to speak. Cultural diversity creates intercultural skills. It also, diversity creates more accountability. We try to avoid discrimination of others, and or try to reduce prejudice of other people. So that is why it's important to us, for nurse managers, to have a good grasp of cultural diversity of our own department, of our own unit. And so change, I think, as I mentioned in the beginning of my presentation, why is it important to understand change management? It's because you are in every organization, there's always situations where you are expected to implement change, right? And I think I only have a couple of slides, Doc Lance, so it should be over. So there are some different forces that will influence change. There are those internal forces. That means that your organization decided to implement change, right? Because they have different priorities, they have shifted their philosophies, and different, decisions that organization make why they want to implement change. There are also external factors such as healthcare economics, technology, restructuring, diversity, and all those kind of things. So both these internal and external factors affect why organizations or why change is important or might be asked upon you as a nurse leader or nurse manager. So strategies for affecting change, we have empirical, rational strategies, right? So those are the things that what makes sense and what's rational. There are some normative and reductive strategies, and there's also what we call as the power coercive strategies. So um, I think the last one is the thing that's really difficult to manage when you are the nurse manager, and things are just being shoved under your throat, like nobody really wants to know or understand some of the things why change is not gonna happen, right? But as far as the organization is concerned, they just want you to implement change. So that's what we call the power coercive strategies. And sometimes I've seen organizations, well, they'll just like, from the top to the bottom. So from the CEO to the directors to the managers, they just basically, force employees and employees, when they do not want to, accept the change, they are forced to be out of the organization, or they just quit. And I do not subscribe to this type of strategy. I believe that in everything that you do in the organization, no matter how big or small of a change that you want to implement, it's important to always have a good discussion with your subordinates, with all the stakeholders, so that they'll be able to understand why you are making the change. And sometimes when you do the discussion and the explanation on the importance of why you are implementing the change, you'll be surprised that employees actually have other suggestions that you have not thought about on how to implement change more quickly. So that's why I think it's a very important for us as nurse managers and leaders to always have that open discussion with our employees why we are implementing change, as opposed to just arm wrestling them to just implement the change, and regardless of whether they believe on that or whether they understand what the change is all about. Um, I think this is a very self-explanatory slide. I always say that not all managers are leaders, and not all leaders are managers, but it's important for us as nurses, when we occupy roles and positions such as a management position, that we need to be both nurse leaders and nurse manager. So as leaders, we should be able to be visionary in identifying the needed change. We should serve as a role model, sensitive to timing and all that kind of thing. As nurse manager, we should also be cognizant about why things had to be changed, or how to manage our employees. I won't read this to you, but I think what I can surmise and just basically consolidate the concept of leadership and management is that leadership means you're trying to actually persuade people to follow you, right? To me, that's the classic definition of leadership. When you are able to persuade other people to follow what you say, that's called leadership. That's the power of leadership. People follow you because they see you as a leader. As a manager, that means that you're able to see some of the the fiscal aspect of the organization, and so therefore you're just don't want people to follow you just by by following you, but actually you should be able to let them understand why financially this is what makes sense for the organization, right? So you might say, hey, why are we using this new product, like for example the IV, a new IV line system, right? Or IV product. As a leader, you can always say, hey, today we're going to use this particular product. But as managers, you should be able to explain to them why this product actually is much better in terms of, patient safety, and in terms of financial, savings for the hospital. So as nurse leaders, you should be able to persuade people to change their ways, but as managers should be able to explain to them why the underlying reasons why we are going that particular route. So as I mentioned earlier, we need to be both leaders and managers in our own organizations. And then we have the type of change. As I mentioned, we have the coercive change. So that means you just try to, coerce people. From the word coerce, you just shove them under their throat. We're doing this or else. Then emulative change, that means that we allow people to follow us. You become the role model. Indoctrination, indoctrinate them basically why we are doing this. Interactional change, you try to interact with people as much as they could, and answer all the questions why we're doing the change. Natural change, you're not doing anything, it's just let the change happen and get its course. And the social change, everybody else doing it both internally and externally, so therefore we should also do it, because that's the expectation for the entire community, right? And this is a very classic model for the change process, and we call this the Lewin's phases of change. First of all, we try to unfreeze what we already know, and then we call the movement, so that we develop what we want to implement, and then you refreeze that. So therefore, you already have a new system. So for example, you're trying to adopt a new electronic medical record. In your organization, you were used to just doing a paper charting, right? So everything is in paper and pencil or paper and pen. You try to unfreeze that practice. You wanted to let everybody know we are going to implement a new EMR system, a new electronic medical record system. So that's the unfreezing. And then movement, that's now the implementation phase, where you are now training your employees with a new EMR system, electronic health record, and then you refreeze that practice. So everybody is now expected to be using the new electronic record. So that's Lewin's phases of change or change process. So that's a very classic example of a change management system. And you can pretty much use this in different change in the organization that you're implementing. It doesn't matter if it's going to be a new system or a new process of work or protocols. You can basically follow this same concept as Lewin's. There's this other theory about planned change. As you can see, from step one, you try to develop the need for the change, and then you assess the motivation and the capacity for change. And then clarification phase, you try to diagnose the client system's problems. Then you establish the alternative routes. Then goes to the transformation of the intention and the efforts to change, and then stabilizing the change, and then the terminal relationship. So in a way, it's similar to Lewin's change process, but this one has it discusses about the different steps of the change or of the planned change. It's another iteration of a change process, but this one is from Havelock. That means that you first build a relationship and then diagnose the problem. You acquire the relevant resources that you have that you're going to implement the change. Then you choose what solution to make, and then everybody gains acceptance, and then you stabilize and the undergoing self renewal. So it still follows the same concept as the previous two ones that we have shown. In terms of innovation, it's kind of similar to change, but when we talk about innovation, we basically are talking about a new way of practicing to be different from others. So to be creative and imaginative. So that means that you're trying to implement change that you have not seen in the past. It's something that is groundbreaking, and therefore that's what we call as an innovative practice, because there's something that you are implementing a change, but that particular change you have not seen elsewhere. So therefore, it's what we call as an innovative practice. And when you do have an innovative solution, not everyone actually jumps in right away, right? So sometimes when people see that, oh, this is something new, Rogers had actually made some statistical prediction on how soon people actually adapt to the change or to the innovation. So statistically, according to Rogers, 2.5% will become innovators, right? So they are the ones that actually innovate. And we're talking about the population here of the particular unit system or a particular community or even the by and large the country, right? So 2.5% will say, okay, you are the innovators. You will be the one to say, hey, say for example, Steve Jobs, right? Or Mark Zuckerberg, they say, okay, we're going to make sure that, the new software will be the one that people use to, to find information or to make transactions or make their communications. So the Mark Zuckerbergs of the world or the Jeff Bezos of the world and the Bill Gates of the world are the innovators. And then there's 13.5% becomes the early adapters, right? So statistically 13.5 of the population will then adopt what the innovators have developed. And then once people see that the innovators and the early adapters have implemented, or what they see the advantages of the innovation and what the early adapters had been using, then the early majority, about 34%, will then follow suit. And then there's the late majority, and then 16% are the laggards. So they are the ones to last follow the innovation. So these are the statistical predictions of when innovations are adapted in a particular population or community or unit. Again, organizational development is from birth to youth and the maturity. So it's always important that organization recognize where they are in the process. If they are just starting up with an innovation, if they are still amateurish, or if they're already mature in the development. And behavioral organizational change, sometimes we call about the culture shock if we are trying to implement a new change. Sometimes it disrupts the organizational structure. It can also have problems as a result of poor communication, if nurse leaders don't diagnose the problem, and it actually can disrupt the equilibrium. So when you bring in change, it's always important that you understand all these different factors, that these are the things that you should look into before you can implement change. Because if you do not understand all these 5 concepts, then implementing a change or adopting an innovation will be really hard for your organization. I think this slide would be better off on the earlier one, but as changes, we have the beginnings, transition, and the endings. But this, I think we have already discussed that particular concept there. And this is my last slide, which says, resistance to change can be because of, covert resistance. People don't say it to you, but when we say covert, that means that they just don't show that they don't want the change. So deep inside, they know that they don't want to follow. And then you have those overt resistance where up front they'll say to you, hey, there's no point in making this change, so I'm not interested in adopting that change. Skepticisms are those people who are at the fence about, hey, do I want to really adopt this new change? I'm not sure. So they are the ones that you would like to educate more, because they are almost at the verge of adopting that particular change. Observation is, as the term implies, people are observing. They are already kind of at the other side of the fence, but then they are still observing what are the impacts of this particular change and how are they affected by that change. Then when they see that it's bringing in positive outcome, they go into participation in that particular change, and then they become committed, and then they champion a particular change. So I think that is my last slide. It's 1:30 in the morning here, but I'm open to questions at this juncture. Doc Glenn.
Thank you, Dr. Jasper. Can I request you to please exit the slide screen? Thank you.
Sure. And I'll also stop sharing.
Noha?
Thank you very much, Dr. Jasper, for your input and for sharing your knowledge with us. I personally enjoyed your presentation. I think everyone else did as well. Thank you very much. And now, everyone, let's move to my fellow colleagues, Malak and Imad, for some questions and answers.
Welcome, everyone. Welcome, Dr. Jasper.
Thank you.
Welcome. First of all, let me introduce myself to you. I am Malak, a nursing student with BSN degree. I really appreciate the precious information you give it to us. Thank you very much.
You're welcome.
Thank you. There is one student asks for all the types of personality. Which one do you think is the most suitable for the nurse and why?
Oh, thank you for that question. So it's my answer. People always ask me that question, which personality is best? There is no such thing, in my opinion, as the best personality, because we are all coming in from different upbringing, different value system, and different belief system, and therefore there is no such thing as an ideal personality. And I'm saying that because as nurse leaders, it's not helpful if we will say, hey, you have this personality and therefore you're a good, nurse. Oh, hey, you have this kind of personality. You actually are obnoxious. You're, on the bad side of the personality. There's no such a thing. When we present, when we discuss about the different personality of individuals, of people, as nurse leaders, we're talking about this personality not because we want to identify which ones are good or which ones are bad. What we are trying to accomplish in knowing the different types of personality is that we should be able to adjust our way of dealing with our nurses, right? So that we should be able to know why and understand where they're coming from, on why they're doing things on particular situations. And more importantly, we should be able to say, my nurse has this type of personality. He's introverted, right? And my other nurse is extroverted. So we're not saying that one is better than the other. What we're trying to say here is that when you develop systems and processes in place, you are guided by these types of personalities. So that means you don't want to say, hey, these are John, Mary, James, Joseph. They are all introverted. You don't want to have one nurse, an introverted person, be siloed and put them in this particular set of extroverted people, right? So what we're trying to accomplish in knowing the different personalities is that we are guided by our own action as nurse leaders and managers to adapt our actions and processes and protocols and the way we interact with people in such a way that we know what are the designs that we implement in our own units, such that it does not really create conflict, right? So you're able to make people work together as opposed to them not understanding each other because of your own system, right? So for example, you do not, when you create your, say, let's say you're shifting, right? So you have your morning shift, your night shift. You don't want to create, your staffing system in a way that, there are people that will not click together. So you don't want to, the advantage of knowing the different types of personalities, that you are able to manage the design of your staffing model, for example, in such a way that you create a successful shift and staffing model for your unit. Because without understanding that, you create conflict with your own staff, and there will be a lot of bickering and fighting. So it's a long way of saying that understanding personality is not identifying which one is better and which one is inferior. It's understanding personality is trying simply to understand how can we design our processes such a way that it will be helpful and positive to our organization. So again, it's not labeling people as being better over the others, but it's a way of designing our systems in such a way that it will become positive and more healthy for our employees.
Thank you very much for your brilliant answer, Doctor. There was also another question. As experienced manager, how do you deal with the employees with opposing personalities? Do you have a specific strategy to deal with them?
Yeah. So I when I was a newer manager, I always say, I said, management is not for everyone, right? You think that being a manager is like all glory because you're the manager, you're the, people report to you, but it's a tough role to be in. It's a position that not everyone possibly can become successful unless you actually learn and train yourself to know how to become a nurse manager. It is something that takes dedication as well and skills to become a good manager. Just like, you become a good ER nurse, you become a good ICU nurse. A nurse manager also needs to have the same type of expertise to become a good one, just like any other specialty, right? So it takes a lot of, again, learning, just like what we're doing now. Also knowing your own self, right? Because without you knowing your own self and your personality and your belief and your own prejudices, it's difficult to, deal with other people, especially with your employees. So when you ask the question of how do you deal with certain employees, and is there an example, I always go back to my favorite tool, which is open communication. It doesn't, in my experience, I've been a manager for a good 15 years now since I took my management position in Yale New Haven Hospital in 2010. I have learned along the way, and I'm not saying it's a smooth ride. I have had my own, bumps and challenges as a manager. But then as I progressed through management, I have learned that the best way to solve problems is through open communication, right? So it doesn't matter if I have a problem employee, I just bring that employee, in a private, office, and I will say, hey, can we discuss this particular situation? Why did this happen? And come to find out, if you don't have open communication with that employee, right? That employee will not share things with you. They will not communicate with you. But if you have an open door policy as a manager, like everybody can come in and out, you don't put yourself in a very high position that nobody wants to talk to you anymore as a manager. If you put yourself in a level where people can actually be collegial and be open to you as a manager, then that's the best way to actually, solve problems and even avoid problems from happening, because people will actually talk to you. I always also say that to my my staff, and I tell them, hey, you guys are adults, right? You are all professionals. That's why you have, nursing licenses. You went through, professional school. As adults and as professionals, you should be able to communicate with each other. Not everything has to be solved by me as a manager. You should be able to, the two of you, if you have misunderstanding, you have to, go to the side and discuss and hash things out by yourself. It doesn't have to be let's go to, to Jasper and we'll settle our dispute. It doesn't happen that way. The best way to actually solve problem is for two individuals, professional individuals, adult individuals, to come into the room and say, hey, can we discuss what happened? Because often than not, it's just a misunderstanding of one's values, belief system. I have employees that's like, come to me in my office because somebody was like, hey, she just yelled at me on top of her voice. And then so I came, put them together in my office. Hey, why did you, yell on top of your voice with your coworker? And come to find out, she's coming from a different culture. I think she was from an African country where their tone of voice is actually high. So therefore, by talking to each other, say, oh, I'm sorry, I didn't understand that was normal tone of voice for you. I thought you are being disrespectful. So that's just one example of, having a good discussion and open communication with each other and with your manager.
Thank you very much, Doctor. I have also another question.
Sure.
We know sometimes our work values force us or pushed us to do things that we don't like. For example, as a Muslim, we are not allowed to drink or deal with alcohol, but some Muslim employees work in an environment or workplace that do, such as hotels, for example. so where alcohol is available. As a result, those employees will have to choose between either they will serve customer needs according to the company's norms and values, or they will follow only their own personal and cultural values. So as a manager, do you believe that the conflict that may arise between the personal values and company values will destroy an individual's identity in some way or not?
Actually a very good question.
Thank you.
And I touched base with that initially in my slide. When I said that when you join organization, you have to do a vetting and really know what those organizations are expected you to do, right? Again, there's, I guess the question, the short answer to your question is like, you have to ask yourself, is this something that I can do without violating my personal conviction? It's something that you will have to ask yourself, do I, or can I do this without resigning or without quitting my job and without feeling bad about yourself, right? And those are the questions that only you yourself can answer, right? As you have mentioned, you know, you're giving some perhaps medication that you don't feel. Let me tell you an example. I was an ICU nurse before, and I remember my patient was having a withdrawal symptoms from alcohol. And when I was about to give my noontime medication, you know, your set of orders, I saw two cans of Hanakind. It's a beer, literally a beer. And in the medication room, I have 2 cans of beer that I have to deliver to my patient in the ICU. I'm in the ICU taking care of this patient who's withdrawing, but then I felt like I'm in a restaurant delivering 2 cans of alcohol, because it's literally beer that I'm delivering. So if you go back to your question about if your religious belief does not allow you to, you know, to serve alcoholic beverage to your patient, you ask yourself, is this something that I can do without quitting my job? Is this something that I can actually talk to my manager and say, hey, can I ask another nurse to give this medication, because I'm prohibited from, and I don't believe, maybe I don't believe in that particular intervention, right? So there is no clear cut answer to the question that you have given, but I guess it's sort of like giving an answer to the, giving a question to the question that you just gave. So my question to you, to the question that you gave, is that something that you can do without quitting your job? How far are you willing to go beyond your belief system, right? And I think the better way is to always understand your organization even before joining the organization. And that's why it's important that we have interview, right? When you apply for jobs, you have to ask those particular question, because no matter how good the offers gonna be, you always have to go by what is the value system of the organization, because without that, it will be a very difficult scenario for you.
You had give us a very smart answers, Doctor. Thank you very much. And now Imad will ask you.
Hello, Doctor.
Hello.
How are you?
I'm good. How are you?
I am Ahmad. I am fourth year nursing student. I have 2 questions for you.
Sure.
First question, as a nurse manager, what dilemmas have you experienced in managing a multicultural and diverse work group? And the second one, what do you think the difference in between a field of work with culture diversity and one without?
Yeah, I love those questions, Ahmad, because I think it reflects what we have, you know, in different healthcare systems nowadays. um, let me answer your first question first before I go to, I mean, let me answer your second question about the importance and the advantages of diversity, and then I'll go with the dilemmas for the cultural diversity, right? So the advantages of having cultural diversity in organizations, no matter what institutions you have, is that you develop certain uh, unique innovations and ideas, because when you have a very homogeneous, when I say homogeneous, that means that a very homegrown set of people, right? Let's say, for example, they're all Caucasian, or let's say they're all Mid Easterners, or we'll say they're all from the Philippines. Having those homogeneous staff lacking diversity, it does not promote ideas and innovations and other um insights that can cultivate ideas in the organization, if you know what I mean. So when you have different staff, right, staff or employees coming from different culture, from Middle East, from Asia, from Europe, America, for example, and you put them all together in one unit, there's a it creates a rich petri dish of ideas and culture and solutions to your organization, because they are all coming in from different perspective. Because remember what we talked about, the value system and your belief system, they're all ingrained, and people are coming in with all this different value system, and they were exposed with from different cultures, they have different experiences, and so then when they all come together in your organization, it creates a rich petri dish of ideas where people can actually cultivate and talk about and say, hey, in our country we solved this situation by doing this, and so perhaps there's a difficulty that you have in your organization that nobody had a good way to resolve, but then you have an individual coming in from different experience and a different culture and say, hey, this is how we address it. And so it creates that beautiful opportunity to resolve problems and perhaps create a new idea or innovation even to implement um, uh, in your own unit or department. As opposed if you just have from your own homogeneous group of individuals. But that's just the positive. To the point of the dilemmas, sometimes it creates a situation where it creates a disequilibrium, because when you have different ideas coming into the situation, it almost like feel that you are trying to implement a disruption into the norm, right? So for example, you have your own staff that's very established, stable, and then you hire somebody coming in from a different culture. It's almost like a disruption, because from something that's very stable, you invite a different person coming in from a different background. It disrupts the norm. The dilemma is that as a nurse manager, you should be able to tap into the positive things that new person is coming in, and allowing others to see that positive thing that is coming in. because the tendency of people from a a disruptive, from having their norm be disrupted, is that they tend to always be defensive. They tend to become closed. They tend to reject people. And our profession is even notorious about, I'm sure you heard about lateral violence, workplace violence, right? So that's a classic example of dilemma of diversity. So you have, a set of nurses that's been working in your unit for like 5-10 years. All of a sudden, you have someone coming in new from a new graduate, maybe, or from a different organization joining your organization that you just hired. Then if you, as a nurse manager, you should be able to explain to your own staff, regular staff, that, hey, we have this new person coming in, has a good ideas, rich ideas that possibly can contribute to our organization in a positive way. If you don't do that as a nurse manager, what will happen is that those regular staff will create a a a very hostile environment for that new nurse. And that's what we call lateral violence, workplace violence, right? The what do you call that? Eating the young kind of mentality, because nurse managers should be able to have the regular staff mentor in adopting and embracing that new change that's happening in your organization. So again, diversity can create positive things for the organization, but at the same token, it can create disruption and some hostile environment. So nurse managers should be able to manage this type of situations.
Thank you for your answer.
You're welcome.
This is all of our questions. Thank you.
You're welcome. And let me just say, I'm sure that you all will going to be good managers, good nurse leaders. I think you have a very good mentor with Doc Glenn Valdez. I know him as a very good, not just a nursing professor, but as a nurse leader himself. He had been implementing change. He's a change manager. So I trust that you will be in good hands in terms of being trained and mentored by a good manager himself.
Thank you, Dr. Jasper. Now we move next with awarding of certificate of appreciation with for the speaker with Dr. Glenford Valdez.
Thank you so much, Muhammad, and of course, Dr. Jasper. Thank you for the kind words. Amani, can you move to the next slide, please? May I invite again Dr. Jasper, of course, our level coordinator, Ms. Noor, who is with us today. So I'm given the privilege to give the certificate of appreciation. So in grateful recognition of your contribution as a resource speaker for the topic entitled Organizational Culture Change, Innovation in Nursing, we are presenting this certificate of appreciation at Oman College of Health Sciences this 10th of April, signed by our level coordinator, level 4, Ms. Noor Al-Zawamri, yours truly, and our associate dean, who would like to extend her regards and thanks for you. She's a bit busy this time. So thank you so much, Dr. Jasper, for the opportunities and of course the thoughts and the information that you've shared that truly enrich the background and of course the understanding of the student regarding organizational culture change and innovation, which is quite timely also because Oman is a very tolerant country. We've talked about diversity and things that are related to working with a diversified group. And I think this is very helpful on the part of the students and our future nurses. So with
Absolutely.
this, congratulations.
Thank you so much for the opportunity, Dr. Glenn. It's glad to always share knowledge to our fellow nurses and future fellow nurses as well. Thank you.
Thank you so much.
Thank you, Dr. Jasper. Now an evaluation link will be sent in the chat box shortly. Please, everyone, kindly check it out, as it will serve as attendance, and you will receive a participation certificate through your emails after answering the question. So please, everyone, make sure to answer all the questions.
Thank you so much, Nuha, for giving them the information. For our participants, kindly please fill up the evaluation form. This would be a basis for your attendance certificate that will be forwarded to your emails later on. So to proceed with the last part of the program, in behalf of our Associate Dean, Dr. Muna Adsoon, and the rest of the faculty members of Oman College of Health Sciences, Dukhar branch, with our level coordinator as well, and the rest of the faculty members who are joining us today in this webinar, I would like to personally thank Dr. Jasper for gracing our program and our invitation. I know I have waken you up. Changes or differences in the time, usually it happens to me as well. So thank you so much. Thank you
No
so much.
worries.
Yes, I think I woke you up in the middle.
No problem. Yeah,
Yes.
no worries. No worries. Thank you for reminding me.
For always contributing, and of course helping us in contributing in the development of our faculty and our students. We send our great regards and thanks to you. Thank you so much, though.
All right. Thank you so much, guys. Appreciate it. Stay safe.
Thank you. You too.
Okay. Bye-bye.
Noha?
Okay, thank you everyone for attending this webinar and for those who work on preparing it. And on behalf of all students, we thank Dr. Jasper for his time with us.
Thank you. Again, I want to thank Dr. Jasper for sharing his knowledge with us and giving us the opportunity to be a part of this webinar. We appreciate every effort that has been put into this event. We have also learned a lot, and we hope that everyone has benefited and learned from this webinar as well. Thank you all for listening, and we hope to see you in other similar future events. Thank you, everyone.